Hello guys, welcome to Knowledge Bites. Guys, today we are going to study about general pharmacology. I'm just going to make this video very simple for you. So starting with general pharmacology. In general pharmacology, we have to study two things. That is the pharmacokinetics and other topic is the pharmacodynamics. So starting with pharmacokinetics. So what really is pharmacokinetics? It is the movement of drug into, through and out of the body. Simply remember, it is the movement of drug into, through and out of the body. Mainly in pharmacokinetics, we have to study four things. That is the absorption, distribution, metabolism and excretion. So starting with absorption of the drug. Okay, the first question arises, that is how drug gets transported across plasma membrane. So the type of transport is passive transport. It is the most common form in which the drugs get absorbed across the plasma membrane. Drugs get transported across the plasma membrane. It is the most common form through which the drugs get absorbed across the plasma membrane. And the other form of transport is active transport and facilitated transport. Now the question is, which form of drug gets absorbed? So the drugs which are lipid soluble gets absorbed, gets transported across the plasma membrane. So question is, why water soluble drugs does not get absorbed? Suppose this is a water soluble drugs. In water it gets ionized, A plus plus B minus, and this is a water, and now this is the ionic form of water. Okay, so A will combine with O and hydrogen will combine with B, so they will get excreted, they won't get absorbed. Okay, now we have known that a lipid soluble drugs get absorbed and water soluble drugs does not get absorbed. So now the question is, a drug is lipid soluble at one place and water soluble at other place. Okay, there may be a situation, then what will happen? Then the absorption depends upon pH. Okay, the acidic drug gets transported across the plasma membrane in acidic medium. Basic drug gets transported across the plasma membrane in basic medium. Okay, suppose I am giving you example of morphine. What is the chemical composition? It is basic in nature. Okay, now suppose a person has taken morphine, it reaches the stomach and after that it reaches the intestine. So morphine in stomach gets broken down into its ionic form because it is in acidic medium, because stomach secretes HCl, so it gets ionized. But when it reaches from stomach to intestine, it gets absorbed. Why? Because in intestine there is a basic medium, and the basic drugs gets absorbed in basic medium. So now we conclude that lipid soluble drug, then the non-ionic form of drug, and the drug in same pH value gets absorbed. Okay, now question is, when we take drug through oral route, it reaches systemic circulation, but before that some amount of drugs gets destroyed. Why? So for understanding this, firstly we will look upon bioavailability. So what is bioavailability? It is the proportion of drug which reaches systemic circulation when introduced in body. Okay, I'm just giving you an example. Just see the diagram. Okay, suppose we give a patient drug 100 milligram. Out of 100 milligram, 30 got excreted. So how much remained? That 70 remained. 70 through portal circulation reach liver. Out of 70, 30 get destroyed. Then how much remained? 40. So that 40 is the biologically available drug. That is the bioavailability. Okay, so what is the bioavailability? It is the 40. Okay, and the drug which get destroyed in liver, this is known as first pass metabolism. Okay, now the question is, factors affecting bioavailability. So the main factor is not the first pass metabolism, it is the drug absorption. The second most common factor is first pass metabolism. Other factors are the hepatic disease. In hepatic disease, the liver does not metabolize the drug, so the concentration of the drug will increase in the body. Therefore we have to decrease the dose of the drug. And the second other factor is the Entero hepatic cycling. that the drug again from the from the circulation, it again reaches to the intestine and again it gets absorbed. And the drugs are the doxycycline, morphine. So enterohepatic cycling is occurring because of that the same drug is utilized more time, and the drugs are the doxycycline and morphine. So now we have completed absorption from the pharmacokinetic part. In the next video we will see the distribution.